Okay, hello everyone and welcome to the Be Well Live series. My name is Dr. Melanie Carminati and I'm the founder of Inspira Physical Therapy and Pilates here in Park Slope and Carroll Gardens, Brooklyn, New York. Inspira has evolved into a virtual team. We are a team now of doctors of physical therapy who are also Pilates practitioners. And we specialize in Pilates rehabilitation, advanced orthopedics, pelvic floor physical therapy. We offer holistic services such as craniosacral therapy, visceral manipulation, and we also treat the special population of dancers. I am very excited today to have Dr. Ben Taylor here to chat with us about osteopathic tips on how to stay healthy at home. So, Dr. Taylor, thank you for being here. And yes, for those who don't know, Dr. Taylor is board certified in the specialization of osteopathic manipulative medicine, also known as OMM, and neuromuscular medicine, NMM, and holds a diploma in clinical homeopathy from the CEDH. He's practiced in Brooklyn since 2009. He's a graduate of the Chicago College of Osteopathic Medicine and completed his residency in osteopathic manipulative medicine and NMM at St. Barnabas Hospital in the Bronx. So now, Dr. Taylor, I will let you set the scene before we start our chat on osteopathic tips.
Very good. Thank you so much, Melanie. It's really a pleasure to be here with you and our viewers. I appreciate the opportunity. So I'd like to start my words with the words of a 14th century Sufi master and poet. Prior to today, I wasn't planning to do that, but this grabbed me this morning. These are words of Hafiz, this Sufi master. And this is a poem, it says, titled Laughing at the Word Two, T-W-O. Only that illumined one who keeps seducing the formless into form had the charm to win my heart. Only a perfect one who is always laughing at the word two can make you know of love. So I wanted to share this because when I think of oneness and connectivity, I often turn to breath. My brain just immediately goes there. My awareness goes there. Both the physical dynamic of breathing, but also breath as a metaphor for life. And so for me, this poem this morning, when I was in the midst of my own morning rituals, brought to mind two of the major factors affecting society and affecting us all right now. The COVID pandemic, which looms large, of course, and the protests for racial justice and equality. And it reminds me of a divine presence or life force, if you will, that permeates and penetrates all that we know and experience. It's not something out there, but rather that which gives us common ground. And it makes me think of our connectivity and our breathing. Breathing, breath, restriction of breath, I can't breathe. They've all become powerful words for us in the protests of today. And of course, breath is a key dynamic in the COVID crisis as well. I just found all this staring at me this morning when I was considering what I wanted to share. And so on the one hand, breath is essential for life, and yet with the spread of this virus, we've all become more mindful of how we are breathing when we're out and about and in proximity with others. We don't want to be the unwitting vector for the disease. Breath and breathing, it's a common theme in both crises of today, and it can remind us that we're all connected, that in some way we're all one, and to the point of this talk, remembering who we are and what keeps us going when we're thriving and well can also help to carry us through the difficult times of struggle, illness, anxiety, and dis-ease.
Wow. Thank you so much for setting the scene like that. That is very powerful. And in Pilates, if you know, breath is the primary principle. So one of the first things we do is work on breathing to help facilitate that mind-body connection. And actually, the name of my business, Inspira, the root of the word means to breathe. Yes. So and to inspire. So I definitely connect to that, and it resonates. And I'm sure it resonates with our viewers. So with all of that said, in the breath and that connection to that deeper source, how can we bring that around to osteopathy? How can we describe what osteopathy is?
Right. Well, in brief, an osteopathy 101, let's say. For those of our viewers who aren't aware, you can be a physician in the United States either as an MD or a DO, and we have all the same legal practice rights and all the same areas of specialization. And yet, our starting point as in the specialty that I practice, OMM, osteopathic manipulative medicine, that's really where osteopathy got its start back in the late 19th century. And so then it grew from there. It was started by a surgeon who was tired of his patients dying from the disease, from the diseases of the time, which they couldn't treat effectively, but also from the medicines they were giving their patients. And so it came out of that. He went back to the drawing board and thought there's got to be a better way to do this. He did a thorough study of anatomy and physiology and looked at breath, among other things, to see how that affects the whole well-being of the person. And he came up with some basic tenets that have been adapted somewhat over the decades since, over the 100 years of since the start of osteopathy. But it's been distilled down basically to 4 principles. And that's, first of all, that the nature of humanity is triune. It's body, mind, spirit, all wrapped into one. They aren't separate and distinct, but they're all active dynamics at play in who we are. And while now we all kind of take that for granted in some way, depending on where we are with our philosophy of life and such, but it's not a earth-shattering notion anymore. But back at the time, in the late 19th century, it certainly was. The next principle is that the structure of the body and its function are inextricably related with mutual and reciprocal interrelationship. So that is the anatomy and the physiology, mutually reciprocally influential. And then a third principle is that we all have within us this innate ability for self-healing, growth, and maintenance. And so then leads to the fourth principle, which is simply that the osteopathic physician, the role as we have as physician based on these principles, is to be mindful of them and apply them in a caring and respectful way that looks at the whole person and not fall into the trap of seeing a disease state as that which we're treating, but rather this person that needs care. So those are that's the basic. That's an osteopathy 101.
Thank you. Yes, that definitely covers all the pillars. So from an osteopath perspective, what are ways to address the effects of sedentary lifestyle that many people have now encountered, that they, previously they weren't sitting as long and now they're sitting more? How does that affect all of these levels and systems in our body, and how do you approach that from an osteopathic standpoint?
Right. Again, we'll be looking at the interrelationship of structure and of function. So the main concerns become, with the lack of motion or movement, fluid stagnation, lack of fluid exchange, therefore. Because one of the guiding principles that we're often working with to keep ourselves healthy is that that fluid has to be exchanged across every tissue interface of the body. Whether it be the stomach or all the way down to the cellular level, or a given joint, or the eyes and the ocular function. But every tissue interface has to have fluid exchange to stay healthy. When that doesn't happen, inflammation comes in and tends to stay in. Things get boggy. If we're looking at more of a macro view or at a joint, you sit too long, someone's ankles might swell, depending on your state of life and general condition. Joint compression, strain, those are common problems of sedentary life. And then, of course, we have stress and anxiety, psycho-spiritual angst of our time is huge. And as these things mount and build and have more and more compressive forces on our lives, our immune system as well can be shut down. And so while in order to look at these aspects which may not be working so well when we're shut in or less active, it's also good to keep in mind that there's a lot more going right than is going wrong, right? You know, more of our body is working than isn't. And so we want to tap into our health is a common way that we like to talk about it. Tap into our areas of health to address those areas which aren't working so well. One of the things I like to do when I've been actually growing in myself is moving away from the anatomy that I learned in a way in medical school, not so much the names and the relationship of parts. That's very important, but more the view that we get from looking at a cadaver, which is, you know, here's the bone, here's a separate nerve, here's a blood vessel. Moving away from that and more toward one that's guided with a perspective informed by models of tensegrity or biotensegrity, where we consider compressive forces as well as tensile forces, and the compressive components don't actually touch one on another but are connected by these tensile forces. And when you move a biotensegrous system in one area, that affects the entire system. And there's even been studies done as this idea has evolved over the past few decades, showing that this is indeed true and can be observed all the way down to the cellular body, cellular level. And so it affects the entire body, and it even affects gene activation and deactivation. And so it's really a fascinating area. And so the reason I bring that to mind is just, again, because of motion being such an important part of our maintaining health, as Melanie highlights with the very question itself. I was thinking about this, and I thought one way to illustrate this might be with an example, and then that will tie one system to another, if that's okay, Melanie.
Sure. Yeah.
Or one of these dynamics to another. And so let's remember as we enter this that we're thinking about the full nature of our humanity. Body, mind, spirit, all firing together, functioning together, animated by breath and all these dynamics of life. And when it's pushed in one way, it might respond in another. And so one example would be considering the stress and anxiety that's just in the air right now. Economic uncertainty, fears around COVID, anger that has surfaced around the racial injustice. And in one form or another, this example I'll be giving, I've seen multiple times, over and over again in the past few months of our sheltering in place. And so, many of us would hold this anxiety, say, in our chest or upper backs, some people in their low back, some people in their solar plexus. But for the sake of this example, let's consider the upper back first. And around areas around the spine, the spinal levels be up above the diaphragm. So that's the area of the body we're talking about, kind of back behind our heart center, if you will, or third and fourth chakra regions. And let's consider that a trigger or a trauma, some threat to our well-being comes in, and that immediately triggers our sympathetic nervous system, our fight and flight mode. And then there's, in that area, right in that heart center, there happens to be a high concentration of nerve fibers from that sympathetic part of our nervous system. And it makes sense physiologically, just to diverge a moment, because our heart has to respond immediately in times of threat so that it can get the blood pumping to where it needs to go in our bodies to respond accordingly. So this area of our body, our upper back, chest, will get locked up, We may feel it in our sternum. We may feel it in our ribs, our tissues and joints in that region become tight. Stress hormones, cortisol specifically, elevates. And we may function at this level in this revved up state for quite a while. And then we start experiencing upper back or chest tightness and pain. But let's say because of the need to shelter in place, as that's maintained without in some way being released or resolved, inflammation comes in, builds up in the area. So that fluid exchange I mentioned earlier is not working so well because we're not moving very much. Joints become more restricted, compressed, and the blood flow is just not coming in, so there's not the extra cellular fluid being carried away from the lymphatic system very well. And so then this triggers more tension, more inflammation, more stress hormone production, and that becomes this self-perpetuating cycle. But then let's take it to the next step if we could, because then if it goes unchecked, more tension mounts. The diaphragm's going to tighten down. So here we are back at the breathing. We were back at the breathing even when the chest tightens up.
Yes.
Too, right? Yeah. But, so we forget about the diaphragm driving a lot of this with its muscular work of it. And so now we're not only responding to that initial trigger, which we experienced as threat, but we're also responding to our thought process that develops of, oh my God, am I having a heart attack? Or is COVID getting me? I can't breathe very well. And so then that feeds upon itself, and the self-perpetuating cycle is maintained. I'm just going to take this a few more steps, Melanie, if I could.
Go ahead, yeah.
Okay, so let's consider that we're not able to get to the osteopath or to our Pilates instructor or our favorite yoga teacher or our physical therapist. And then the digestion gets thrown off as well. Because when the parasympathetics, that fight and flight mode, is revved up, the rest and digest and restorative mode doesn't work so well. The parasympathetics doesn't work so well. So then our digestion backs up, and that continues to cause more trouble. The tension through the upper back and neck goes right up from the neck, ties into the throat, back of the head, and then before we know it, our head is locked up, literally. It's just not moving well. The cranium, the bones that do move in relation to one another. There's ossification, but remember, this is living tissue in our head. Bones are living tissue, right? So there's still movement through there, through the membranes of the skull and all that. But that all gets tampered down. We may get headaches, vertigo, nausea. That even could bring on a sense of depression because our pituitary gland is not going to be pumping out hormones properly because the head's not moving so well. And everything gets thrown out of balance that way. Cortisol levels could become depleted. If this goes on too long, we become fatigued. And then even immune compromise sets in. So this just goes on and on, so on and so forth, until we can find a way to shift those dynamics. So it's a long-winded way of saying what might physiologically occur.
Happen, yes, during sedentary times. Yeah. So we actually touched on chronic inflammation in the live stream yesterday because we were speaking about fascia.
Fantastic.
And myofascial release and how fascial restrictions occur. And tagging along with what you were saying, I do visceral manipulation and craniosacral therapy, and I was saying when you have that subtle perceptiveness in your hands and you're able to feel fascial, superficial fascial restrictions, visceral fascial restrictions, you're able to feel that whole thread. And when you're able to feel that connection, I was giving an example of mobilizing a bladder of a patient and then feeling restrictional pulls through the diaphragm, through the lungs, and just watching that all unwind. Feeling that unwind.
Yeah, watching, I get it, yeah.
So it is an interconnected matrix for sure. and it just continues on in that way.
And so there you are, shedding light to the whole tensegrous relationship of things.
Exactly. Yeah. So what recommendations would you give for patients to manage these things that we just talked about?
Oh, was I supposed to make recommendations too?
Oh. Do you have any tips?
I'm just kidding. Okay. Yes. So I was overwhelmed with kind of my own thoughts sometimes. They all want to come out at once. And so I had to distill it down, and I found a simplified way of doing this. And I found myself thinking in terms of motion, mindfulness, and meals.
Oh, okay.
And what I'm thinking here is motion, both at the microscopic level, as well as the macroscopic level. And in the microscopic, what I'm talking about is in osteopathy, as you could appreciate from craniosacral therapy, which in visual manipulation, a lot of that comes out of the osteopathic
yes, absolutely.
practice. Craniosacral therapy came directly out of it.
Yep.
And so it's appreciating that primary respiratory mechanism, that subtle motion. It's a fluctuant motion that we can palpate when we're trained to do so in our bodies. And it can sometimes be referred to as an inherent motion, which can be palpated throughout the body, even on the big toe. Even though a prominent way, one area where it's most prominent is where the central nervous system is centralized, and that's in the head. So we often do our work in this way from the head, or as Melanie mentioned, sacrum with craniosacral therapy. But what we're looking at is the microscopic level there. And so we can that microscopic motion is incredibly important. So you might ask, how do we nurture that ourselves without, say, a trained osteopath or a craniosacral therapist? Well, I think meditation is an extremely good way of doing that. Prayer is contemplative prayer, mindfulness practices that way. It's extremely important. Sleep is essential because that's where we get that cleaning up of the nervous system and the clearing away of the cobwebs, if you will. So meditation, prayer, sleep, and then back to mindful breathing exercises. That restores that inherent motion that we all have in our bodies that just needs some reinforcing sometimes. Now, the macro part of motion is more what we think of in terms of whatever exercise of your choice, whether it be yoga or tai chi, swimming, biking, hiking, swimming, hopefully soon, I should know it, jogging, weight training, calisthenics, walking the dog, walking the self. In other words, just getting out and walking, but be aware of your walking. So then these can also become integrated, the two, the micro and the macro, right? We can be mindful about what we're doing and therein stimulate even greater motion within our bodies. I mentioned mindfulness already, but a specific mindful practice of your choosing can be very helpful with these things, whether it be meditation, yoga, as I mentioned, contemplative prayer and breathing. Oh, I wanted to mention also there's a fabulous app called the Breathing app. It's developed by Eddie Stern, and it's a wonderful little tool to help you. I say little tool, I don't mean in a diminutive way, but it's a wonderful tool to help guide one as they learn to control their breathing. So it's just the Breathing app. But breathing, the reason I bring that up is because it helps to balance the things we were talking about earlier with the autonomic function. By lengthening so the inhalation part of our breath tends to trigger and be driven by the sympathetic part of our nervous system, where the exhalation part of our breath is more of a parasympathetic function. And so we can influence that mindfully by steadying our breath, but then controlling our breath so that our exhales are about twice as long as our inhales. And in doing so, we can increase our restorative mode and to help bolster our parasympathetics, which is how we take care of ourselves. And then the third M that I mentioned, meals. What I'm really thinking of there is, you might just say eating healthfully. But one of the areas that I've done studies in lately that I still have a lot to learn about, but is the basics of whole food, plant-based diet. Mm-hmm. And I'm finding the more I learn about it, just how important it is by just cleaning our diets up as best we can. Then that allows for times of indulgence or splurges. But it helps with decreasing inflammation. Cardiovascular health improves by eating a whole food, plant-based diet. It has, we get more antioxidants, more free radical neutralization. It can control blood glucose, so diabetes can help that. Weight control, of course. But then also our overall energy can be improved and just more stable. So those are 3 big categories: mindfulness, motion, and meals.
Yeah, I mean, you covered it all. Those 3 aspects for managing being in quarantine, living a sedentary life now more than ever, can also be applied right to how to safely return to your normal routine.
Right.
So,
absolutely.
Great. Well, thank you so much, Dr. Taylor. This was very informative. You gave us so much information, and I know that everyone greatly appreciates it. So thank you.
My pleasure. Thank you.
Yes. So I just want to let everyone know next week is the last week of this series. I will be continuing lectures, interviews, I'm saying lectures, interviews and mini lectures, I guess, as well, throughout the rest of this virtual world. So next Wednesday at 5:30 on Instagram, I will be bringing on Kit Behun, and we'll be chatting about innovation and the transformative power of Pilates. She is a Pilates instructor here in Brooklyn. And then next Friday, also at 5:30 p.m. on Instagram, I'll be chatting with Sarah Choi. She is a holistic nurse and founder of Sarong Healing, and we'll be chatting about compassionate self-care and shifting your internal dialogue to that of self-love. She'll also give us a sample sound healing session towards the end of that talk. So tune in for that on Instagram. And Dr. Taylor, thank you so much for your time.
My pleasure. Thank you.
Be well.